And we're back. Welcome back, everybody, to the second public hearing on the Legislative Assembly's Select Committee inquiry into cost of living pressures in the ACT. We are now joined by Minister Emma Davidson, the Minister for Disability, Minister for Mental Health, and Minister for Veterans and Seniors and officials. Welcome, everybody. I'll read a short statement and then I'll ask you each to introduce yourself, the capacity in which you appear, and acknowledge that you read and understood the privilege statement on the pink laminated paper on your desk. I remind witnesses of the protections and obligations afforded by parliamentary privilege, and I draw to your attention the privilege statement. Witnesses must tell the truth. Giving false or misleading evidence will be treated as a serious matter and may be considered contempt of the Assembly. Please confirm you understand the implications of the statement and that you agree to comply with it. We'll start with my left and move along.
Thank you. Morgan Eddy, the Senior Director of Community Relations and Funding Support within the Communities Division. And I acknowledge the privilege statement. I've read it and acknowledged it. Thanks.
Thank you.
Hi, Anita Perkins, Executive Group Manager for Communities Division and Community Services Directorate. I've read and acknowledged the privilege statement.
Thank you.
Emma Davidson, I've read and acknowledged the privilege statement.
Elizabeth Moore, Coordinator General, Office for Mental Health and Wellbeing, and I've read and understood the privilege statement.
Thank you. And on the screen?
Hi everyone, Catherine Rule, Director General, Community Services. I have read and acknowledged the privilege statement.
Minister, do you have a short 2-minute or less opening statement for the committee?
I do.
Tremendous. Take it away.
Okay, I wanted to start by covering who I actually have responsibilities for as a minister. So there's around 50,000 older Canberrans, around 50,000 unpaid carers in the community, around 80,000 people with disability, probably around 80,000 people who have a mental health condition, and 11.2% of the households in the ACT have a veteran in them. So as Minister for Veterans and their families as well, that's quite a lot of people. Now, the common threads amongst all of these people are that they're all dealing with a constrained income and higher health expenses, but for all of them, their biggest living cost is housing. That is absolutely the biggest cost of living for all of them. Now, to quote from a woman who participated in consultations for the Women's Centre for Health Matters submission to the 2018 Housing Choices consultations, people who only have casual work, and that includes our disability workforce, can't get a mortgage. Now, the 2022 Office for Disability consultations for the ACT Disability Strategy also found that having enough money for everyday things was one of the top 5 concerns. There are a lot of people in our community for whom rent is actually how they are going to be able to pay for housing, and they might be doing that in the private market for the long term. There was something that Craig Wallace said to me back in about 2017-18 when we were working together in community sector, that choice is a privileged concept, and he's absolutely right. Not everyone gets the same choices. Now, there was a report published by Everybody's Home on the 11th of April. It's called Priced Out, and it shows the percentage of income that would be paid on rent for different kinds of workers in the ACT. For an aged care worker, it would be 76%. For a childcare worker, 78%. For a cleaner, 75%. For a nurse, 70%. And for a retail worker, 74%. Now, those socio-economic challenges that people are dealing with, they do contribute to poorer mental wellbeing. The Australian Institute of Health and Welfare reported a reduction in the levels of high psychological distress from the peak experienced during the lockdowns, but by the end of 2022, it still had not gone back to pre-pandemic levels. People are finding these pressures quite difficult to live with on a day-to-day basis. This could be why we've seen an increase in young people in particular with increased anxiety and depression, with eating disorders starting at a younger age, older people who are experiencing social isolation and loneliness. We know that domestic and family violence often increases during and after disasters like the Black Summer bushfires and COVID-19. And we've seen an increase in people needing support for things like mental health, drug and alcohol dependence, housing, financial counselling, and food relief. So these cost of living pressures are real, they are growing, they have an impact on people's physical and mental wellbeing. And I just want to thank this committee for taking the time to explore what we can do about it, either at an ACT level or advocating for change at the Commonwealth level.
Thank you, Minister. I will start with questions and then we'll move down the panel. Minister, It appears to me, looking at your portfolio remit, that you have responsibility for some of the lowest incomed and most vulnerable Canberrans. Can you talk to some of the specific programs that you have delivered, not just through COVID, but that continue to be delivered to some of those people?
Yeah, sure. I might start with food relief services. I know that you've had submissions from organisations like Food Bank and St Vincent de Paul. Now, our community food relief services are reporting an increase in demand of up to 60%, and that includes seeing a lot more two-income households than they used to see. So even having two incomes in a household is still sometimes not enough to put food on the table every night. Those community food relief services are absolutely beyond capacity for what they can deliver for people. What they're finding is that the rising costs and supply chain issues have meant that their food relief dollar only buys about half of what it used to. The cost of freight has fluctuated by up to 150% more since July of 2022. The ACT government is doing everything we can to help, so we're supporting them with some of those additional freight costs and working with the community food relief providers on long-term solutions. We have also resourced Volunteering ACT to support that community food relief network and develop a database for them, and we've provided resourcing of $475,000 over 4 years to help with that. But really, when we're talking about food relief services, we're talking about, essentially we're putting a band-aid over the gaping wound that is housing affordability. When people are spending so much of their income on their housing costs, there's just not enough left for everything else, and for some families, that's impacting on their ability to buy food.
Thank you. Can I ask on that? I mean, it seems to focus on housing costs impacting on the people that you're supporting. What measures, in addition to those that the government is already implementing, do you think we should at least be considering, this committee should be considering, the community should be considering?
Yeah, I think that honestly we really do need to keep working on that housing affordability issue. When we're talking about the kind of housing that people can afford, thinking about the fact that, say, we have a relatively high average income in Canberra really hides the disadvantage that some people are experiencing. So we really need to be talking about what can someone on a median income afford to pay. Now, Matt Cowgill and Greg Jericho have written extensively on how averages can hide disadvantage, and that we really do need to be talking about medians. But certainly there is data published on the ACT and where those disadvantages are most concentrated, and Women's Health Matters and NatSem have published those reports in recent years. Now, if we're going to think about what that means for people, median gross incomes and labour force participation rates are lower for women, they're lower for people with disability, they're lower for unpaid carers, and unemployment and underemployment are higher for those same people. So these are people who don't have the higher incomes to be able to pay high rents. But what we've seen is over the decade from 2007-8 to 2017-18, housing costs as a proportion of household income rose for the lowest 40% of household incomes in the ACT, but for the top 20%, housing costs as a proportion of their household income actually decreased. So at the same time as that was happening, we saw across Australia the percentage of Australian households who owned their home dropped, as did the percentage in state or territory-owned public housing, but the percentage in private rental housing rose. So what we're seeing is that there are more people on lower incomes who are trapped in the private rental market in housing stress, and that has a real impact on their physical and mental well-being. Now, we're doing everything we can to support people through that. Making sure that we have universal public mental health care is about a lot more than just going to the GP, getting a mental health plan and going on a wait list for a private psychologist. And so we have been investing heavily in making sure that we've got a diversity of community-delivered mental health services like dialectical behaviour therapy, eating disorder services, homelessness outreach, step up, step downs. We've got the first safe haven, we've got PACER. But really, we've got to do something about that primary cost of living issue with housing affordability. Yeah.
Any supplementary questions, Ms.? No, Ms. Lawler?
Yep. Sorry, you just mentioned Safe Haven.
Yes.
And we had at least one witness. One. Talking about of young people talking about the success, what they saw as a positive result with Safe Haven, and recommendation that there could be more in other geographic areas. Is it a government-funded and run project? How does it work?
Yeah, absolutely. This is an ACT government initiative. It provides a place where someone experiencing distress can walk in with no need for an appointment, no need to show a Medicare card. All that happens is you realise you need some help, you need to talk to someone, and you can walk in and talk to a human being, a peer mental health worker who understands what you're going through and can help you work through that. And it's been very successful. And so, yes, of course, we want to have more of them.
Successful, you mean in terms of the number of people who are approaching, in terms of outcomes for those people? What do you mean by?
Yeah, absolutely. So since it opened, we've seen that there are people who've been to the Safe Haven and have returned multiple times because they've found that that's helpful. I talked to one person in particular who said that they had found that since they'd started going to the Safe Haven when they were experiencing distress, they'd actually needed to use their NDIS plan less and have fewer additional appointments with their psychologist because they were able to solve problems before they became so difficult that they needed additional psychologist care. And that is a really positive thing. So being able to provide people with places that they can go in the moment when they realise that they need to talk to someone rather than having to wait for an appointment is really helpful.
And sorry.
No, please. I've got a supplementary on this too.
Do you have the information? You may not have it with you right now, but is it people in the Belconnen area going? Or?
It does have wider appeal. So that person that I was just talking about actually lives in the Molonglo Valley area of Canberra and travels to Belconnen to the Safe Haven. So people will travel that far to get there. It's right next to a bus stop, so it's really easy to access. The reason why we opened the first one in Belconnen was because the data that we had from the PACER service indicated that actually that area of town was where we were experiencing the most need, and so that made sense as a place to open the first one. But the co-design team that designed the first one also wanted to see a Safe Haven on the Canberra Hospital campus, so we're also working towards having one there as well. But yeah, certainly I can see the benefit in having more of them.
Thank you. Ms. Lawler, you gave me a prompt for a supplementary I wanted to ask as substantive, so I've got to thank you later, because you brought up the Tomorrow Movement submission, and the Tomorrow Movement actually named you in this room earlier, Minister, as the reason they knew about the committee existing and knew to make a submission, so thank you for that. One of the things that they raised, they were the only people to raise it in fact, was a climate jobs guarantee. And so I wanted to ask someone in government what their idea, what their perspective is on that pitch, a climate jobs guarantee, and if that's something that we could deliver in Canberra.
Yeah, so I've been hearing a bit about people looking for a climate jobs guarantee, and what people are looking for is opportunities for people to have meaningful work with a livable income in things like care work that we know we need more of, and that people do find really meaningful work to be doing. Now, in order to do that, getting the qualifications, that costs money. So we've had a Commonwealth program that provides free CIT places in care work like peer mental health care and disability care, but that Commonwealth program is going to come to an end soon. It'd be great to see that continue because it means that more people can get the qualifications to go out there and get the jobs, and there are jobs there. It means, looking for more partnerships with Canberra's universities, like we did with the ACT government funding that went towards the Professor of Mental Health Nursing at University of Canberra, where they're developing a graduate certificate in mental health. Now, one of the other difficulties, though, is that at the end of June, the indexation of student HECS debts is going to happen, and that's going to be 7%. And what we're going to see is that student HECS debts are growing faster than their wages to be able to repay them. So, this is one of those areas where if Commonwealth could work with us on this, we could get more students qualified to do these jobs that we really need in our community, and without ending up with a huge debt that they can't afford to repay at the end of it. It means providing meaningful work with a livable income for people.
The HEX debt is one thing, but if I can just pick up on those CIT courses, just so I'm clear and I understand what you're saying. There are a range of courses people can currently do in Canberra to get jobs in the mental health field that are subsidised down to zero through a Commonwealth program, and that is about to end.
Yeah, and that also includes disability care as well, and we know that we need more disability care workers, yeah.
Have you had any advice, letters, representations, Facebook messages from your federal counterparts to suggest this will stay, this federal funding will continue to flow, or will either these people be expected to pay for these courses in the future, or will the ACT government have to pick up the bill?
Yeah, and I guess this is the difficulty that we're facing, is that we know that we're going to need a growing workforce in these areas. I know the Commonwealth is wanting to work on getting more people into care work through their task force. This is one of the things that would really help. So I'm keen to continue advocating strongly for making sure that we can get people qualified without leaving them with a huge debt.
Thank you. Dr. Patterson?
I guess, mental health has been a issue that's, come through many of the submissions. Has there been, there was a lot of investment and, I guess, pivot in services during COVID. Has there been a acknowledgement through the service delivery of this cost of living crisis in terms of how services are delivered, or what particular programs are being run, or cohorts that are being targeted?
Yeah, so absolutely we're seeing that the cost of living pressures on people, the socioeconomic factors that go into people's wellbeing, does have a real impact. But in everything that we do within ACT government, when we're looking at what we can fund, we're always looking at how can we fund a diverse range of mental health services, so that people are not just being funneled through a primary healthcare system that, as you heard the Chief Minister saying earlier, really needs some serious investment, and that we can make sure that people are able to access the right kind of clinical service for what their need is. For some people, it's going to be a psychologist with one-on-one appointments, but for other people, it might be a group therapy program like dialectical behaviour therapy, or it might be a program that integrates alcohol and other drug services with mental health care. There are things that Commonwealth can do to help. So, for example, the Commonwealth funded programs like WOKE, which is based out at the University of Canberra for young people, and Stepping Stones, that's being delivered by Catholic Care through the Capital Health Network. That funding is about to come to an end, and we've heard nothing from Commonwealth about what they plan on doing to support these services ongoing. Now, without those services there, those young people who are accessing mental health care through those services are going to be in some real trouble, and we really need to make sure that Commonwealth is working with us on this, so that we're not, we're not dealing with a fragmented health system with funding, here, there and everywhere, and that it's actually planned and integrated.
Are they solely funded programs by the federal government?
That's right, yeah, through Capital Health Network.
So is the ACT government identifying gaps or potential gaps, like in youth mental health? We heard today evidence that Headspace, is not meeting the needs of young people or the way young people engage or want to engage with mental health service. Is the ACT government exploring new programs and pathways to, I guess, target particularly vulnerable groups in our community?
Absolutely we do, and this is why it's so important that we have the Office for Mental Health and Wellbeing able to work across ACT government directorates to understand what are the contributing factors to people's mental wellbeing. How do we prevent people ending up with mental ill health? But if they do, how can we intervene earlier with the right kind of program? And so that's, that research and analysis and planning component of the work is really important. And we've been able to see some great success where we've seen opportunities to do things like, the first Safe Haven opening or expanding the PACER program. We've been able to do that because we've had the Office for Mental Health and Wellbeing there doing that work in an ongoing way.
And is there any future programs or work that are coming on board that, because the PACER one and the Safe Haven, they've been around for a little while now, so.
Yeah, absolutely. So expanding the number of step up, step down services and safe havens is something that we need to be looking at for the future. But also we got funding for a youth at risk trauma service that is really important for young people who perhaps don't have a DSM-5 diagnosis and aren't going to fit into the usual models through, say, Headspace or child and adolescent mental health services, but they still need services and support to deal with trauma and to deal with the impacts that's having on their mental well-being. And so Office for Mental Health and Wellbeing working with the community on what does that service need to look like, and making sure that that the design of that service takes into account people's lived experience, what we already know are the gaps. That's how we're going to get a really good service out of it. And that was funded through that bilateral with Commonwealth last year.
And when's the delivery timeframe for that? What's the process for that? So.
I might pass to Dr. Moore, who can talk about the detail of that youth at risk trauma service.
So, thank you, Elizabeth Moore. We have funding for 4 years, and there are several elements to the project. One of them is actually to make trauma-informed practice one of the mainstays of all children and adolescent services. And the other part is really to look at those children who are at risk of severe mental illness, who have complex needs, and design a bespoke service for those children. But if I could just come back, one of the main things we heard was actually that people didn't know where to go or what services were available. And so that's why Mind Map has been incredibly useful for our young people. And the other thing is, people are anxious, they are depressed around cost of living. They do need support, but they also need pragmatic things like financial counselling. And so it is not just acute mental health services, it's that range of services that the Minister talked about, and where to access them at all ages.
I've just got a quick supplementary because we've spoken about it in many other committee hearings about MindMap. Might you be willing to take on notice updating the committee on the traffic on that website and how that's flowing through to young people actually connecting with services? It'd be good to see the trends since it established to now, and hopefully that's an upward arrow, right?
It is. It varies over time and goes down during school holidays, which most services do, but I'd be happy to take that on notice and provide that.
That'd be tremendous. Thank you. Ms. Litter for a substantive question.
Thanks. We heard yesterday from Food Bank about, and you mentioned it in your opening statement, Minister, about the huge increase, for example, in diesel costs impacting on their delivery, or the cost of their delivery of food to the ACT. They talked about, their wish list of perhaps being able to establish a warehouse in the ACT, which would reduce their fuel costs, but also reduce transport emissions and enable quicker and more frequent delivery of food in the ACT area. And I asked the Chief Minister this. He said that you would be the better person to respond. Have Food Bank approached you, and are you having some discussions with them about how you may be able to support them?
Yeah, absolutely. We have had conversations with Food Bank, as well as St Vincent de Paul and lots of the food pantry services and community food relief providers around Canberra about the problems that they're facing. Those supply chain issues and those freight costs are very real problems. When you've got a service that is largely run by volunteers or community sector workers, being able to stretch their dollar as far as they can, it reaches its limits. The important thing is that we're working with the community food relief providers to try and work out what is going to be the best solution for all of them, because there's such a diversity of food relief providers in Canberra, from the communities that work food pantries to some of the smaller local church-run services. Getting that understanding of what their needs are and how we can best support them is the reason why we resourced Volunteering ACT with the ability to have that project coordinator there and to keep that network connected and engaged. I might pass to Anita, who can talk a little bit about what we've been doing there.
Yeah, thanks, Minister. In addition, we have established a regular monthly meeting with St Vincent de Paul, who we actually have a contract with, and we provide funding with for the freight costs. And they then work direct with Food Bank. So we've established a monthly meeting between ourselves, St Vincent de Paul and Food Bank to keep working through these issues and to make sure that we're getting a really good understanding of the demand that's coming through the food pantries. And then in addition to that, we also have ongoing correspondence with the food pantries that are accessing the freight and the goods from Food Bank. And I might hand over to my colleague Morgan Eddy, who can provide a little bit more context in what we're hearing from the food pantries and the work that we're doing to explore what are some other options that we can be considering in the medium and longer term.
Thanks, Anita. So like the Minister mentioned, emerging demographics we're seeing in the community food pantries are the 2 income households and also young people sourcing their own food. The Minister mentioned the volunteering contract, and one of the pieces under that is a communication strategy to destigmatise access to supports. Again, that has a double-edged sword of increasing demand, so really important that through the food relief network that volunteering have established that everyone's coming together to continue talking about creative and innovative solutions to supporting the demand that we're seeing in the emerging cohorts. We are continuing, as Anita mentioned, to work with St Vincent de Paul and Food Bank on some of those ideas. And I did hear the CEO of Food Bank on the radio yesterday morning about some of those ideas that they've proposed. And we're working with them through that monthly meeting to see what that looks like on the ground and how we might be able to continue to support them.
I also heard yesterday from a couple of individuals who are running little community pantries, quite small and targeted to their neighbourhoods. Yeah. And they sort of talked about some of the difficulties that they're facing in terms of interacting with local businesses because they're not a charity, not registered, they're having some difficulties, and they asked whether there is anything that could be done to provide them with some sort of, legitimacy in some way that didn't necessarily involve having to register a charity or unincorporated association and have a board and have rules of incorporation and insurances and all of those things. Are they included in your discussions about food pantries?
We are working with a range of providers, but they are the providers that are supported through the freight subsidy, which is small to medium community food pantries. We do know there's a scaffolding approach, a layered approach to food relief in the ACT, and that starts with people helping people in their own streets, moving through to street pantries, the smaller community food pantries that are attached to churches, and then our larger providers as well. So I guess in terms of the volunteering ACT work as well, being part of that work and creating that stronger advocacy voice is really, really important. So whenever we're coming across new, smaller players, we're connecting them in with volunteering ACT so they can be part of that food relief network and work together to respond to the increasing demand they're seeing.
Okay, so it's sort of a work in progress, is that what you're saying?
One of the great things that happened actually, in terms of community supporting community during all the difficulties we've had over the last couple of years has been the rise of informal volunteering and mutual aid groups and things like that, just setting up, seeing a need in the community and saying, well, I want to help and I've got the capacity, so I'm just going to start doing it. And that's been really fantastic. But in order for them to be able to keep doing it, they need spaces, they need that scaffolding that Morgan was talking about. So having got some resourcing for the development of a social recovery framework within the Community Services Directorate last year, I think is really important in helping us to understand what actually do we need in order to build that community resilience. Is it about community spaces where people can come together and self-organise how they support each other? Is it about how we support community groups who are setting up for the first time. What kind of things do we need to actually do? And that social recovery framework will help us to understand that better.
Thanks.
Thank you, Ms. Lauder. Any supplementaries? No? Conscious of the time, I'll get one in. I have to ask you, Minister, and then I'll defer to my colleagues because it's been sticking in my craw. Yesterday, during our hearings, we met with Minister Berry and Minister Bazzarotti to talk about housing, which you've raised a lot in your testimony today. Minister Berry indicated it was the position of the ACT government to support Federal Labor's Housing Future Fund. I wonder if, as a minister in the ACT government, you share that view.
It is not my understanding that that's the ACT government position. It is certainly, we need social and affordable housing construction investment. We absolutely need that, and we need Commonwealth to help us with the resourcing to be able to do that. But the difficulty is that future fund is a gamble, and it could well see the housing crisis get worse. And what we really need is a better deal from Commonwealth Government with a commitment to invest more in social housing year on year. So if we can negotiate a better deal from the Commonwealth Government, absolutely we want to be able to get the best deal we possibly can for the ACT.
Is that the ACT government's position?
The ACT government doesn't have a position that I'm aware of on the federal government's future fund.
What you've just said about a better deal, is that coming from the ACT government?
I'm not aware of there being an official ACT government position on the Federal Labor Future Fund.
Oh, so this is your opinion?
This is my opinion, is that we do need a better deal from Commonwealth Government, and we absolutely should be negotiating for the best possible deal that we can get for the ACT.
So, Minister, you just started your first 10 minutes of submission saying how affordable housing and public housing, the needs of the most vulnerable in our community for housing. So isn't the ACT government's position to see the supply of housing come to the ACT as quickly and proficiently as possible?
We absolutely need to see a greater investment in social housing, and what we know is that, for the Australia Institute put out a report on the 11th of April that showed that 93% of the economic growth benefits from 2009 to 2019 went to the top 10% of Australians. Now, that top 10% get their income from ownership of profits, not from wage income. And that has an impact on the housing market. It has an impact on people's ability to pay for housing. Now, this is data that's come from the World Inequality Database that's been developed by some very expert economists, including people like Thomas Piketty. What we know is that the rich are getting richer, the poor are getting poorer, and housing is becoming more expensive, and the system is breaking. And what are we doing
Minister,
about it?
your view seems quite contrary to Minister Bazzarotti, Minister Berry and the Chief Minister, who were all expressing a need for this housing funding to come to the ACT as fast as possible.
I do want to see funding come to the ACT as fast as possible, and I want the ACT to get the best possible deal that we can from the Commonwealth Government. I think that we can get better than this at the moment, so I want to see us continue to negotiate for a better deal. There isn't an ACT government position on this.
Delay funding?
Let the Minister answer.
No, there isn't an ACT government position on this, but we do need to take action, and we need to take decisive action quickly. We can't just sit here on our hands and watch
What's
the
the
world
action
burn.
we need to take, though?
We need to see Commonwealth Government put more
Money
funding
into housing.
social housing.
Thank you. I think
Not through a gamble, through an
So
ongoing...
the federal
question-
government's current policy is a gamble, is that what you're saying?
What I'm saying is that we need an ongoing commitment for more funding from Commonwealth Government into social housing year on year. We need that, and we need it now.
Thank you,
I
Minister.
mean, frankly, the difficulty is that we've got a situation where young people are in crisis. They're dealing with multiple problems, from climate change to COVID to the housing crisis to the casualisation of their workforce to their growing student debts.
Yeah,
And
there's
frankly,
also a
if we don't
difficulty.
Dr.
As a
Patterson, you've cut the Minister off.
Yeah,
We don't
has a
have
different view. And
Dr.
different
Patterson, if we
Hang
don't
on.
fix this problem, these young people will and should come for our jobs. And that will be giving them no opportunity but eat the rich.
I appreciate, I'm going to draw a line there. This is my substantive. The question I asked the Minister specifically was to identify the ACT government's position
Which we
on a policy.
Yeah.
The Minister's answered that question.
There is no position, is that right?
That is
Yes.
correct. As far as I'm aware, and I'm an ACT government minister, I would know if there was a government position on this. There is not.
Thank you. Dr. Patterson on a substantive.
No, thanks. I'm fine.
Ms. Lauder?
Yes, it's sort of a bit Commonwealth governmenty, sorry. But we've talked a little bit about bulk billing, access to GPs, and so I'm sure you're aware of some recent difficulties that veterans were facing with GPs declining to take the gold card with bulk billing. What's been happening in that space? Has there been a resolution, do you know? As I said, I know it's...
Yeah, I'm not aware of a resolution yet, but I think this reflects the broader problem we have with not having enough bulk billing GPs in the ACT. We don't have enough GPs full stop. And so we're seeing that problem play out for our veterans as well as for every other household in the ACT. We really need to be able to work with Commonwealth on fixing that primary care system. And I know Commonwealth are looking to work with us on this. This is an area where some good collaborative work could make a real difference to people's ability to access the services they need sooner.
But you're not aware that it's been resolved?
Not yet.
Thank you.
Forgive me, Ms. Lauder, I'm having a brain fart, which I hoped would never get on the Hansard, but here we are. Did you just mention, was it the Veterans Wellbeing Centre? Because that was a question I'd intended on asking the Minister. Can I just get an update on that, Minister? Because you've spoken previously in the Assembly about lobbying the Commonwealth for a Veterans Wellbeing Centre.
Yeah.
And we don't have one.
That's correct.
Where's that up to?
So we don't have one at the moment. What we're looking for is a Veterans Wellbeing Centre for veterans and their families. We've got a really diverse range of veterans in the ACT, much more diverse than most other cities have, because we've got serving veterans, we've got veterans who have paid off from service or who have retired. We've got a lot of young people as well who come to Canberra on a posting cycle with their parents and have, been through a lot of change and disruption and need a bit of extra support and connecting up with local community when they get here as well. So there's a real diverse range of things that veterans and their families need. Now, whether that Veterans Wellbeing Centre is on the ACT side of the border or on the New South Wales side of the border in Queanbeyan, it needs to be able to provide services to people on both sides of the border. So the recent conversations that I've had with federal ministers, including Minister McBain, about what's possible, have reassured me that the intention is absolutely that veterans on both sides of the border will be able to access this centre no matter where it's built. But it sounds like they're pretty committed to seeing it built in Queanbeyan. Now, if that's the case, that's fine. But we just want to make sure that the full diversity of ESOs and VSOs are able to get access to that space to deliver their services.
And just bringing us back to our terms of reference around the cost of living, is it your expectation based on veterans wellbeing centres across the country that veterans will be able to access services or facilities at this site that they're otherwise paying for out of pocket and they get them at this site either free or subsidised? Is that the model?
Yeah, so sometimes that is what they need. They need, access to help with employment and education and training services or with mental health and wellbeing services. Sometimes it's actually about connecting up socially and finding the other people that you can do those things with. I was talking to a currently serving veteran a couple of weekends ago. I was out at an Invictus Australia event out at Stromlo. And they were talking to me about the fact that even though they've got a job, they're a serving veteran. The cost of living pressures mean that they don't have a lot of additional cash around to pay for things like sports and recreation activities for themselves. Invictus Australia coming into Canberra and running a mountain biking workshop was a great opportunity for them to connect up with other people who understand what it's like being a veteran and are also into the same kinds of activities, and it's great for their mental wellbeing and for keeping them going. Now, having something like a Veterans Wellbeing Centre makes it easier for people to go there and find out what's on, who can I connect up with, how can I join up.
There's 1 minute left, so I'm going to give us up to Ms. Lauder. A substantive? A question. A minute. No, take it away. Fill the time.
In case you give a very quick answer, we spoke in the Assembly recently about the review of the seniors card. Has that been completed and where are we up to?
Yeah, so I'll pass to Anita who can talk more about the timeline for where that's up to. But yes, I was actually looking at the listening report for that piece of work just today actually, and yeah, certainly one of the difficulties that has come up through that listening report is some of our older Canberrans not knowing what kind of concessions they can access using their seniors card, and making sure that people know this is what the seniors card can get you could make a real difference to people's ability to deal with cost of living, particularly when they're on a fixed income after retirement. But Anita can talk more.
Conscious of the time, so we'll see how quickly Ms. Perkins can answer.
Or you can provide it on notice if you prefer.
We are working through the final recommendations. They will be considered shortly.
Yeah.
So it's imminent.
Will it be in any kind of soon time frame that you may be able to provide an update to the committee for us to include in our report?
The listening report will be released shortly.
Published,
so
if that's at all possible,
Yeah,
that
absolutely.
might be helpful.
So just to be
I know
clear,
that
are
will be
you
published on the Your Say website shortly.
taking it on notice to provide the committee with a copy of that listening report once it's published?
Yeah, we can do that.
Thank you.
Thanks.
All right. Time being 3 o'clock, the committee is adjourned for 15 minutes for afternoon tea. We're going to reconvene at 3:15 where we'll be hearing from friends from Advocacy for Inclusion.